Welcome to the Pathways to Wellbeing Documentation course, Intensive Care Coordination Note. This course is one in a series of learning opportunities designed to help you familiarize yourself with pathways to well-being and continuum of care reform concepts, practice, and documentation. Pathways to Wellbeing supports youth by bringing together the child or youth and their family, behavioral health services, child welfare services, and other critical partners to support the safety, permanency, and well-being of youth involved with the child welfare system. As a behavioral health service provider in the County of San Diego, your responsibilities under Pathways to Wellbeing include creating and maintaining complete and accurate documentation of service activities. This course will describe the Intensive Care Coordination Note and how and when to complete this note to document intensive care coordination services conducted outside of child and family team meetings. This short course is designed to introduce you to the Intensive Care Coordination or ICC note. You'll learn what it is, when the ICC note must be completed and approved, multiple ways to access the ICC note, how to complete the ICC note, and some helpful tips to support you along the way. The ICC note is used to document any ICC service conducted outside of the Child and Family Team or CFT meeting. ICC is a service that is mandated for members of the KDA subclass and available through the Early and Periodic Screening, Diagnostic, and Treatment, or EPSDT, benefit to all children and youth under the age of 21 who are eligible for the full scope of Medi-Cal services and who meet medical necessity criteria for these services. ICC is provided through collaboration between the members of a CFT. To provide ICC services, the CFT must have been identified or must be in the process of being identified. ICC requires active, integrated, and collaborative participation by the provider and at least one member of the CFT. ICC is a service used for the identification and coordination of ancillary supports and systems, which promote safety, permanency, and well-being. ICC services are offered to clients with significant and complex functional impairment and/or whose treatment requires cross-agency collaboration. Programs will utilize the ICC Service Code 82 when billing for ICC. The ICC note must be completed after rendering the ICC service and used to document any ICC service conducted outside of the CFT meeting. As a reminder, the CFT meeting note is utilized to document ICC services that occur during a CFT meeting. See the Child and Family Team Meeting Note Documentation Microlearning for more information. When more than one staff member provides ICC services, each staff member is required to complete their own ICC note. The ICC note must include identification of the staff member's unique role, function, or contribution, demonstrate medical necessity of the service, and the time billed must be clearly substantiated. The electronic version of the ICC note is found and completed in Cerner Community Behavioral Health, or CCBH. Form fill versions are available for programs that do not have access to CCBH and can be found on the RISE, Pathways to Wellbeing, and Optum San Diego websites. To access the ICC note in CCBH, log on to CCBH with the appropriate staff credentials. Select the new Progress Note drop-down menu. Select Individual Progress Note and save. Select the Standard tab drop-down menu. Select ICC Progress Note template to fill out the ICC note. Complete all sections of the ICC note. The prompts are useful guides for what to include in each section. Travel to, from. Enter applicable location origin and applicable location destination. Does this service include working toward identifying the Child and Family Team, or CFT, or has the CFT been identified? Answer yes or no. ICC requires collaborative participation by the provider and at least one member of the CFT. If a team is not currently or in the process of being identified, the service does not meet the criteria for ICC Service Code 82. Intensive care coordination intervention. Describe the purpose and content of contact as related to teaming, supporting the client's stabilization and mental health needs. Include the response of the provider in all contexts. Include how the documented intervention addresses the client's functional impairment. Complete at least one of these sections. Planning, assessment, or reassessment of strengths and need. This includes gathering information to determine needs, ensuring plans are integrated with system partners, and identifying goals and objectives in accordance with the client plan. Referral, monitoring, and follow-up activities. This includes evaluation of plan effectiveness, reworking the plan as needed, and referrals and recommendations to meet the youth's needs. Transition to promote long-term stability. This includes demonstrating client plan goal achievement, plan for transition for the youth and family from formal to informal, natural and community supports, and a plan for warm handoff. Functional impairment. Document the youth's current impairment, symptoms, and behaviors affecting functioning that is the focus of the service being provided. Functional impairment includes identification of areas in the youth's life that are impacted by their mental health. Response to intervention or observed behaviors. Include a description of the interventions used and the youth's response to the interventions. Document what you observe in their mood and behavior. If the youth is not present, document any responses to intervention or observed behavior of the youth as reported by the member of the CFT you are collaborating with. Plan. This includes the next steps, including any change in the client plan, referrals given or recommended, future CFT meetings that are already or need to be rescheduled, updating or collaborating with other team members, warm handoffs if indicated, and any other follow-up regarding previous plans. Overall risk. When completing this section, enter information pertaining to client risks, such as suicidal attempt or ideation, self-injurious behavior, homicidal ideation, aggression, or other indicators of elevated risk. If the client is deemed to be at elevated risk, the provider must document interventions, including safety planning. Additional information. If applicable, provide any pertinent information that was not included in other sections of this progress note. Some helpful tips to remember. A CFT must be identified or be in the process of being identified to provide ICC. A CFT meeting does not need to occur for a provider to provide ICC services. ICC requires participation by the provider and at least one member of the CFT. For youth identified as eligible for enhanced services subclass, ICC must be added to the client plan. The ICC note must include identification of the staff member's unique role, function, or contribution. It must demonstrate medical necessity of the service, and the time billed must be clearly substantiated. If there are any questions or concerns regarding collaboration with the Child Welfare Services, or CWS, Protective Services Worker, or PSW, please contact the BHS Pathways to Wellbeing program. The Pathways to Wellbeing team roster can be found on the Pathways to Wellbeing and Continuum of Care Reform page on the RISE website under Contact Us. The URL is displayed on screen. Providers use the ICC note to document all ICC services provided outside of a CFT meeting. In this course, you learned what the ICC note is and when to complete it, how to access the form in 3 different locations, how to complete each section of the ICC note, and some helpful tips to support you in accurately documenting ICC services. We encourage you to review the other courses in this learning series. Thank you for attending this course.